So we're gonna close your eyes, shake your head yes, shake your head no, keep your eyes closed, come back to where you feel comfortable, don't open your eyes. I'm gonna say she's laterally flexed just a little bit to her right. She's more laterally flexed than rotated. From in-person view, I don't know if you guys can see that, but she's starting to laterally flex a little bit more.
As she relaxes.
Yeah, as she relaxes, she's starting to tilt a little bit more, so that's good. Yeah, I'm saying it's more laterally flexed.
Okay.
So we're gonna look at this. Her left is higher than her right. Her left scapula is elevated, right scapula is depressed. If we go in here, pretty even, so that's not jumping out. Again, that's pretty even. That's pretty even. So her scapula are not bad, except one's higher than the other. We're gonna turn you back around. Her right is lower than her left. Do you guys see that? Her right is lower than her left. If we look at the elbow creases, they don't look too terribly bad. If we look at the palms, the back of the hands, still not too terribly bad. Nothing jumps out as far as pronated or supinated from that standpoint. I'm gonna say her elbows are a little flexed. I'm gonna say that this wrist is a little ulnar deviated, right there. Her thumb over here is a little extended on her left side. So I'm gonna look at the hips. So her right hip is higher than her left hip. Can you guys see that? Mm-hmm. Right hip is higher than the left. And if I go ASIS, PSIS, that looks normal. ASIS, PSIS, that looks normal. There's no extension there. If I go back of the knees, nothing really jumps out there. So we're gonna have you sit up here. I just wanna look at the knee here and go, yeah. That's slightly off, which is what it's supposed to be. That's a little bit more, I'm gonna say externally rotated on the left side. So now we're gonna go and look at the feet. Can you guys see the feet? And so, okay, I'm calling dorsiflexed.
And if the ball of the foot's lower than the heel of the foot, it's normal. And if you look at it from the side,
Depends on how far, because a normal, the 400 that we measured, it was a lot bigger than that.
really,
The angle was a lot bigger than that. Yeah. So that's a dorsiflexed foot in my book. And then I'm going to say it's a little bit everted on the right ankle.
yeah.
Toes look fairly good. You
Extended
could
on
say
the right.
extended on the right side. Her toes are extended on the right side. All right, so then we can come down and hit calculate and see what the brain tells us is the issue based off their postural imbalances. They got a C7 and an S1 problem. C7 is the primary, S1 is the secondary as far as the treatments that we would want to do. And then if you want to follow along the treatment video, we have the treatment video that plays. I've muted the volume, of course. And you can watch that all the way through. That particular video is 12 minutes. That's just me. I do a lot of teaching in that particular video, so I talk a lot. But then we've got the exercises that you can give, very specific exercises. You can save the treatment page, and it saves all the information, all the postural imbalances that we chose, all that kind of stuff. And then when we're ready, you can go up and click the logo and start again.